Hi guys, welcome to our webinar today. My name is Kaylee. I'm Dr. Katinka's patient care coordinator at the Spiro Clinic, and we are so excited to be here with you guys today. If you can, please drop a line and let us know where you're watching from. We always like to see where people are tuning in from, and if you're a former patient, note that as well. We would love to say hello. So I just want to start by saying if you're watching today, you or someone you love is probably in chronic pain. And oh, here we go. We have our first one. So far we have New Jersey and Virginia Beach. Hi, Kelly and Nicole. Thank you guys for tuning in today. Anybody else? Do we have anybody watching from outside of the US? Let's see. We have Ellen from Phoenix. Hi, Ellen. Connecticut. Awesome. Florida, California, hi Taylor, Texas. So already we have people from all over the country. Oh, hi Sabine and Bar. Sabine and Bar are former patients from Belgium. Hi, thanks you guys for watching today. So I just want to say this. Oh, here we go. We have one from Holland as well. Hey, Allison. Allison is getting ready to start treatment in January. She's watching from Pennsylvania. We have London, Colorado, all over the place. So this webinar actually looks a lot like our waiting room. We tend to have patients from all over the world. So that alone should bring you a little bit of comfort in knowing that even though you might feel like you're alone in fighting this battle right now, you aren't. And there are a lot of other people who are going through the same thing that you are. So as I was saying, if you're watching, you or someone you love is suffering from chronic pain, and chances are you've been down a very long road and seen a lot of doctors, and you're probably to the point where you're just exhausted. So that's where we come in. We are dedicated to providing hope to you guys and treating the most hopeless cases. We attack it from every way that we can. We have a whole body approach. We're not just going to sit here and accept that you have to be in pain and manage your pain for the rest of your life. That's not good enough for us. So with that being said, I would love to introduce Dr. Katinka. She is an international speaker and author, but more than that, she is the brains behind this whole operation, and she is the reason why you guys can have hope today and know that it's possible to get better. So Dr. Katinka, here you go.
Thank you for that amazing introduction, Kelly. I appreciate it. Thank you to each and every one of you who took the time out of your schedules today. I know that often you are in horrific pain, and so to take even this step is commendable, and I appreciate you joining us. Today I'm going to talk to you about this amazing system we have put together to treat patients with chronic pain. If you have any questions during the webinar, please post them in the comment panel, and I will try to get to a few of those questions when we are finished with our material. Also, I'm so excited because I'm going to present a way to you today that you will get to speak to me one-on-one about your specific situation, and I'm going to tell you more about that later. So this system that I have put together has been perfected over a period of almost 9 years now. And there are so many parts to it. It is pretty complicated, but the purpose of it is to bring normalcy and balance to your central nervous system. So we have different ways of approaching it. I call it the shotgun approach, meaning we hit it, we make sure that we hit our target from different angles. And I call it the one fits one approach, because each of you is unique. Your nervous systems are unique, your problems are unique, your symptoms are unique, your history is unique, how you respond to supplements is very unique. And so you really have to tailor make each treatment program for the patient. Most of you have gone the medical route, and you've done so often for many, many years. Now, I am not here today to be negative about medical doctors or Western medicine, but I will say that outside of emergency healthcare, when it comes to chronic pain, we all know that medicine tends to address chronic pain through the following ways, and that is surgery or biochemical approaches, meaning opioids, medications. We can have spinal cord stimulators implanted next to the spinal cord to interrupt the pain signal. There are drugs like ketamine, which is a dissociative drug that is meant to disconnect the brain from the body. But what all these approaches have in common is that it treats the symptoms. And whenever you only treat symptoms and you're not getting to the cause of the problem, it's the same than if you had a fire alarm going off in your house and you say, oh, I don't like the sound of that, and you put a wet towel over the fire alarm because you don't like the alerts that your body is giving you. Your body's way of communicating with you is through pain. It is trying to tell you something. It is trying to tell you that it is in trouble. And the problem that I have with the medical approach is that we're saying we're going to numb the signal, cut the signal, chemically interrupt the signal, but we don't like this signal. But what about the cause of your problem? We all know what the outcome is of treating symptoms. Most of you have tried, you have fought, you have done everything your doctors have told you to do. In the beginning, when you first get diagnosed, you have hope that somebody's going to be able to figure this out and help you. And so when you see your doctor, you tend to be a good patient and do everything you're supposed to do. And then when you realize going from doctor to doctor to doctor to doctor, that your problem isn't getting solved, you become very despondent and very hopeless. So if nothing else, I hope that you leave this webinar today with fresh hope, an appreciation for what your body is capable of, and just a sense that you are not powerless. There are holistic programs out there in the world that can in fact be very, very powerful. Now, when I say holistic, I mean anything that approaches the body as a whole. When we go to our medical doctor, they tend to address our bodies like an engine with one part that isn't working anymore. And then if another part breaks, that's a different doctor that you're going to. So let's say you have, for instance, complex regional pain syndrome, but also you're not sleeping at night, and now you have depression and your GI system is no longer functioning, you're not digesting food, you have a lot of nausea, then you're going to go see a psychiatrist to give you medicine for depression. You're going to see your doctor to give you something to sleep at night. You're going to see your pain management doctor to manage your pain. You're going to see your GI doctor to give you yet more different medications to manage the GI tract. Holistic doctors know that the whole body needs to operate together to work effectively. But the problem is that often, and many of you have tried holistic things, maybe you've tried acupuncture, you've seen functional medicine doctors, you've seen chiropractors, and then you may say, well, you know, I've tried that. The difference between that and our system is that we now have 15 different techniques and technologies that we've all put together, where one technology enhances the next synergistically, meaning they become exponentially more powerful when they're done together rather than just one thing separately. I have a patient here right now from Pennsylvania who said, oh, I've tried this scar tissue therapy before and it only made me feel worse, but when I tried it here, it was amazing. And it's not that our machine is so much better than the machine she tried before, but it's that we do all these things together in synergy. So one thing helps the next and the next to work better. So I understand that you guys are going to have questions, and listening to this, you're going to often think, well, you don't understand, you know, my situation is different, my body doesn't respond like other people's bodies, and that's why I feel it's so valuable that I'll be able to touch base with you one-on-one and get to really address your individual concerns. I want to tell you how I got started in this work, and it's a story very close to my heart. 8.5 years ago, I was very frustrated in practice. I really wanted to help desperately ill patients, but I was seeing patients with back pain, neck pain, headaches, and honestly, I was bored to tears in practice. And then I found my first technique that I thought was truly groundbreaking that stimulates the vagus nerve. And that has a very calming effect on the nervous system. It addresses inflammation of the nervous system and also massively addresses anxiety, depression instantly to calm the nervous system down so that your body can just sort of get its legs underneath itself so you can stand up and start fighting. And so Carlos came in. He had full body complex regional pain syndrome. Complex regional pain syndrome is a condition where you feel like your whole nervous system is on fire and you're being burned with a blowtorch. He also had gastroparesis, so anything he ate, even chicken broth, which is all he could take in at the time, he would eat it, and then his insides would feel like they were on fire. He would curl up in a little ball and just scream in pain. And so Carlos came to me with his wife and his 9-month-old son, Sean, and said, my wife found me as I was about to commit suicide, and I agreed to go see one more doctor. And then she said she would let me go and she would forgive me if that's the route I had to take, because I cannot live like this anymore. And that one more doctor was me. Talk about crazy pressure. I remember crying. I saw him. I saw how much pain he was in visually. He was a Hispanic gentleman. He was white as a sheet. You could just tell that he could barely sit up. And so my dad is a doctor, and I went to my dad and said, what if I cannot help him? And he said, but what if you could? And something about that moment resonated with me. One of my favorite quotes is, you never know how much something you say, do, or think today will affect the lives of millions tomorrow. Something ignited my passion. I went out, I did the vagus nerve technique on Carlos. That night he left my office for the first time in 3 years, could eat a whole meal without screaming in pain. And 14 weeks later, Carlos was in full body remission. No more signs and symptoms of CRPS. He has since, in the last 8.5 years, had severe trauma. He had a fracture, he had gallbladder surgery, and the complex regional pain syndrome did not come back. Now, I've talked a lot about complex regional pain syndrome, but I want to stress that we do not treat symptoms. We treat the central nervous system. We remove blocks that keeps that system from functioning correctly. And then we just step out of the way so that the body can heal from within. Every second, your body is managing billions of chemical reactions. Billions, not thousands, billions. And think about the intelligence that takes, the vast intelligence. I don't care what doctors say or what Google says when you go and Google your condition. Your body didn't just one day sit down and say, oh, I don't know what to do anymore, and we're just going to be sick for the rest of our life. And now we're going to have to give you ketamine and give you implanted devices to interrupt pain signals. You guys, we can do better than that. Your body is amazing and it can heal from within. And if you only hear that message from me today, please believe me when I say I've seen the worst of the worst hopeless cases in our clinic, and we see miracles all the time. Not just every week, but every single day. We have miraculous moments in here. Nothing gets me more excited than if a patient comes to me and says, I can't get better. I'm at the end of my rope, and they say there is no hope for me. This is an incurable condition. And then we help the nervous system to regenerate from within. We reconnect the brain with the body, and the patient starts healing from within. they have that first moment of hope where perhaps their pain drops from a 20 to a 5 out of 10, and you can just see all over their faces and their mom's faces and their spouse's faces. That moment of hope is so addictive. So how do we address pain? What makes our system so special? First off, we use, like I said before, many different things together, not just one thing. So to give you an idea, just starting with the brain, we address toxicity in the brain. We address heavy metals in the brain. I have never seen a chronic pain patient where the brain wasn't affected. The brain always remembers trauma, physical trauma, emotional trauma, chemical trauma. And if the brain, which is the captain of your body, cannot do its job, it cannot communicate and run things, you are never going to heal. So it has to start from above down, inside out. We have a technology where we record brain function with EEG equipment. That's the same equipment that they hook you up to in a hospital to see if you're brain dead. It measures brain function, and then we show the brain its own function. The brain is very strange. If it sees its own mistake, it's a mirroring thing. The brain immediately says, oh, I didn't know that. I can fix that the second you point it out to the brain. So we bring about balance in the brain that way. Pretty soon, at the end of December, we're going to have a new system where the patient is hooked up to a virtual reality program, and they move through obstacle courses and games where if you cannot use a limb, or let's say you've lost a limb, you have phantom limb pain or complex regional pain syndrome or Ehlers-Danlos syndrome or fibromyalgia, we let your brain think that it's healthy and you're moving like an athlete, so the brain can start doing remapping. We address brain toxicity, heavy metals in the brain. That's just what we do with the brain. We have this insanely good physical therapy where we hook you up to a direct current. And yes, chronic patients can tolerate this current. You have a very skilled therapist with you every step of the way, where each minute that you're hooked up to the machine, or each movement, that you're doing while you're hooked up to the machine, is the equivalent of 250 physical therapy moves. That is mind-blowing. And when you guys watch our videos on Facebook, by the way, let me just interrupt and say we are the Spero Clinic, SPERO, and we're on Facebook, and we post videos almost every single day of some of those miracle movement moments. So please make sure you join us on Facebook so you can watch those videos. When you see videos of we're about to post little Cole as he's running, and soon you're going to see him do some gymnastics. When he came in 10 weeks ago in a wheelchair, and his dad had to lift him up off the table and lay him down on the table, and you wonder how that is possible. It's because of this special physical therapy that we do. We reconnect the brain with the body, and then we turn atrophy around very, very quickly. We address your blood work. We look for chronic viral infections, anything that can block your healing. So one size doesn't fit one. Each patient is special. And lastly, I want to say our secret sauce is love. And that may sound cheesy, but my staff is absolutely amazing. Each one of them is very passionate about what they do. They care about patients. They care about the outcomes. I love my patients. Our patients are encouraged to make friends with other patients. There are no divisions in our clinic. There are very few walls in our clinic. It's an open area. We promote love. We promote encouraging each other. So that is our system. I know that I can only tell you a fraction of what I would love to tell you about it. But before I hand you back to Kaylee, our fantastic patient care coordinator, she's one of the most loving staff members I have. I want to leave you with this thought. It's more than pain. You were given this one precious life, and what you do with that life may affect the lives of thousands tomorrow. You have people around you that love you, and they're affected by your misery. So you need to keep fighting, not give up hope. If nothing else, join us on Facebook today and make sure that you keep your hope alive. Your life is worth it. Thank you so much for watching. I'm going to have Kaylee share our exciting offer to you. Oh, first, few questions. I so miss interaction with patients, and now I'm doing more of that, and I absolutely love it. No, we are not still using the Vector device during treatment. So our system, when we add something that we think is better than something old, we tend to drop the older procedure to keep the costs down. So we no longer use that system. And yes, I need to update that book. Nicole, thank you for pointing that out. It's one of the things on my to-do list. Right now, we're in a massive growth spurt where we're really focusing on updating our treatments. So I will be updating the book soon. Thank you for that great question. Thank you for watching today. And I'm going to hand this back to Kaylee.
Aw, thank you guys for your, someone just wrote in saying there are no words for the caring love and support from you all during my healing process in amazing Fayetteville. We love having those messages. That's what's so special about our clinic too. Healing is so much more than just the treatments you get. It really is the environment, it's the encouragement, it's meeting other people who know your struggle. It's just an amazing place to be. So I just want to let you guys know that we do have a special offer for anyone who tunes into this webinar. You are able to get a $49 phone consultation with Dr. Katinka. This way you can give her all the details about your condition. She can give you feedback. You can run ideas off of her. She's really amazing. And so I just want to show you really quick how you can do that. So I'm going to, we just have one more question. I want to answer it. Is your treatment similar to revalidation therapy with chronic pain patients? She's shaking her head no. So I do not think that is the same thing. Give me 1 second. I'm going to share my screen with you guys. Okay. So if you would like to book one of these consultations, what you'll do is go to www.drkatinka.com. That's drkatinka.com. You will click here and you'll be taken immediately to a calendar page. All of these dates in blue are going to show the dates that she is available. You can click on one that works for you, and then it will show you the times that she's available as well. So they're very limited spots. As you can see, there's only about 3 a day, and they do fill up quickly. So from that point, you would click the time that works for you, hit confirm, and then it's going to ask you to enter details. You're going to enter, make sure you have the correct phone number. And if you are an international patient, please, if you can, in this little comment box, write either your Skype or your Zoom information, because we won't be able to contact you by phone. But if you're in the US, please just leave your phone number. Then you'll be able to go ahead and pay. You have the option of either paying through PayPal or paying with a debit card. So either way, I really encourage you guys to do that. It's an amazing opportunity to get to speak with her. Oh, we have someone else writing in. Let me look. Oh, it just says, thank you so much for what you do. Thank her. She's awesome. But thank you guys for tuning in today. We hope we can speak with more of you guys, and we will see you on our next webinar. It will be 2 weeks from today at noon again. Thanks so much.